In our surgery coding video series, today we will learn wound debridement. Last week, I have posted one video related to excision, lipoma or cyst, where you have learned all the tips in order to know how to decide whether to code lipoma or cyst using the operative report. And wound debridement is also one of the most important concept every outpatient medical coder must and should know. The objectives of this session will be, first we will see definition of debridement, next we will see types of debridement, next we will see levels of debridement, next we will see debridement hierarchy as well as few example scenarios related to debridement. So what is wound debridement? Wound debridement is the medical procedure where physician will remove devitalized, contaminated, infected or necrotic tissue to promote healing and reduce the infection. Whenever you want to code debridement using the CPT code, we need to code based on deepest level of tissue removed, not based on the wound depth. Next, we have 5 levels of debridement. Okay. Skin level consists of epidermis plus dermis. Subcutaneous tissue consists of subcutaneous tissue, or otherwise we will call it as deep subcutaneous tissue. Next we have muscle and or fascia. So these both comes under one level. So that's why we have 5 levels. Next one is bone level debridement. Okay. So total 5 levels. Skin first level, subcutaneous tissue second level, muscle third level, fascia fourth level and bone fifth level. But for skin level, if the patient performs debridement, we need to code or we need to use 90,000 series codes. So 97597 for first 20 square centimeter or less, 97598 each additional 20 square centimeter or less. Okay. So basically here what is the key thing? Whenever physician performs debridement of skin level layers like epidermis plus dermis, we need to use codes from 90,000 series. Next we have subcutaneous tissue debridement. Okay. For subcutaneous tissue we need to use 11042 for first 20 square centimeter and 11045 for each additional 20 square centimeters. As we have discussed previously, muscle and or fascia are having the same codes for debridement where we need to use 11043 first 20 square centimeter as well as 11046 for each additional 20 square centimeter. Last level or deepest level is the bone level where we need to use 11044 first 20 square centimeter and 11047 each additional 20 square centimeters. So if you observe here, whenever you want to code debridement, we need to start from superficial to deepest. Okay. For example, if the patient removes or patient perform debridement of fascia, we need to use 11043. So fascia is the more deeper than the skin level. So we need to code fascia like 11043 for first 20 square centimeters. So what do you need to check while coding this debridement in the operative report? So basically, in order to code accurately, we need to check anatomical site of the wound. So exactly where is the debridement? Next, deepest tissue debrided. As we have 5 levels of debridement, so we need to code based on deepest level of the tissue debrided. Next, also we need to check total surface area debrided, like whether it is less than 20 square centimeter or more than 20 square centimeter. And also what is important here is the documentation contains diameter in centimeter. We need to convert into square centimeter. Why means these code descriptions are based on square centimeter, not based on centimeters. Also we need to check surgical technique used, whether physician is performing excisional debridement or any type of chemical debridement. Okay, or any type of enzymatic debridement. Next, you need to check for any presence of necrotic or devitalized tissue. And also you need to check whenever you use any CPT code, you need to check the medical necessity. Okay, so you need to check the medical necessity for all the CPT codes. For example, if you want to code 97597, in the documentation, you need to check debridement of skin level disease or skin level mass or skin level cyst. So that is the medical necessity. What are the debridements common coding mistakes? So coding is based on wound depth instead of the deepest tissue actually removed. Next mistake is conversion of centimeter to square centimeters. If you don't know how to convert centimeter to square centimeter, please mention in the comment section of this video. I will create one more video related to that. So sometimes coders will use multiple primary debridement codes instead of add-on code. Okay. So for example, if the patient performs like bone level debridement, 45 square centimeter. Okay. How do we code? We will code 11044 for first 20 square centimeter and 11047 for next 20 square centimeter and remaining 5 centimeter. Again, we need to use 11047. But some coders will code like that. They will code 11044 three times for 45 square centimeter. But that is not correct. So you need to code 11044 and 11047 for bone level debridement, 11047 twice and 11044 once. Total 3 codes. And one more important mistake coders will encounter is type of debridement. Okay. So if the patient performs selective debridement, you need to use 90,000 series codes. If the patient performs axial debridement, you need to use integumentary system codes like 10,000 series codes or 11,000 series codes. So next we will see what is the hierarchy. So deeper tissue is called higher CPT code level. So here hierarchy is skin level first, subcutaneous tissue second, muscle fascia third, and bone level fourth. This is the hierarchy. So what is the pro coding tip here? So whenever you want to code debridement, we need to check the operator report carefully. Okay. The documentation contains down to bone. So which does not mean bone debridement. You need to code muscular fascia debridement. So if you want to code bone level debridement, patient needs to mention through the bone. As CPT coding is based on deepest tissue removed, not based on the exposed or visualized. So what is the importance of coding properly? So which will provide accurate reimbursement, reduced claim denials, better compliance with payer guidelines, as well as high quality clinical documentation. So thanks for watching this video. If anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is the description of this video. And also if anyone looking for same-day surgery training, IPDRG training, SEC training, CC certification training, please send WhatsApp message to 707-526-3939. And also anyone looking for more videos, just you can mention in the comment section of this video related to your toughest topic.